And finally, so this is our last case, the last one that I wanted to show you today. This is for an incidental left breast finding that was found on routine follow-up for the opposite breast. So this is similar, if you remember, case one was a very similar presentation where a patient came in for a follow-up on the other side. We end up finding a very small, subtle abnormality on the contralateral breast. So here we have images from the left breast craniocaudal view. The power look density assessment is a heterogeneously dense category C, as we can see here. There is nothing suspicious or focal on the left CC 2D mammographic view. As we get into the still images from the tomosynthesis, and again, this is a case where I've sort of frozen it right on the slice with that suspicious finding. But if you can imagine really scrolling through this dense breast tissue, this was a finding that was really hard to see in this patient because of her particular tissue pattern. And in fact, I initially did not see it until I saw the detection of the profound AI. So that very small little irregular asymmetry in the outer aspect of the breast made much more conspicuous in this case by the detection of the profound AI. So my level of suspicion always increases, especially when I can see it in both views. So here we go to the MLO view from that same case. So again, heterogeneously dense breast tissue without a suspicious focal finding on the 2D portion of the exam. When we go to the still images from the 3D, I've frozen it on that suspicious slice where I can see that very subtle area where it's just slightly denser than the tissue around it, maybe a little bit of architectural distortion, but very subtle to pick up prospectively until we see the detection of the profound AI, which is where we have the right-hand image just showing the detection of AI and the profound AI making it a much more conspicuous area of concern. So because of the level of concern and the fact that we could see it on two different views, this patient did go for a diagnostic ultrasound. So here we can see another example of a really fairly subtle irregular hypoechoic mass at the 4 o'clock position. And this is again is a small, less than 1 centimeter irregular mass that corresponded with mammography. This patient did proceed to have an ultrasound guided biopsy. And then on this final image where we're showing the biopsy clip for this patient, nicely corresponding to the very subtle finding that had been detected by the profound AI. This was another case of a sub-centimeter invasive ductal breast cancer that was incidentally detected on a patient who had come in for routine follow-up of the opposite breast. So as I've mentioned in this final case 5 here, it's just another example of being able to highlight a really small and subtle finding where the profound AI really makes those suspicious subtle findings much more conspicuous to the radiology. These findings can be really, really easy to miss. In fact, this one was a near miss on my part. Because of the dense breast tissue and just because of the subtle way in which that mass had insinuated itself in the dense breast tissue. So this is an example of profound AI sort of as that second reader where, I had gone through and of course looked very closely at all of the images. That initial finding had escaped my detection and then profound AI highlighted that as a suspicious finding and we were ultimately able to detect a very early breast cancer.